When we talk cortisone, you need to automatically, like we talk about in all of these different lectures, you need to be thinking steroid, okay? When we talk zone, that a lot of times is going to refer to a glucocorticoid, okay, or a steroid. So cortisone is the generic name for the trade name drug Cortone. This is given for the management of adrenocortical insufficiency or Addison's disease, and it can also be given for conditions like inflammation and to reduce swelling and things like that. So what are these steroids? Okay, what are these glucocorticoids? Well, we know we have two kidneys, right? Optimally. And on top of each kidney, we have what's called an adrenal gland. The adrenal gland is like a triangular shaped gland that sits on top of either kidney. Now we know glands, what they do is they secrete hormones, okay? So from these adrenal glands, the adrenal glands actually secrete these steroid hormones, okay? So the action of cortisone is to replace cortisol in states of deficiency. Okay, so cortisol is a glucocorticoid, and what this does, what the cortisol actually does, is it suppresses inflammation and normal immune response. Okay, the adrenal gland excretes these steroid hormones, including cortisol, that play a central role in increasing blood sugars, immune suppression, metabolism of fat, protein and carbohydrates, as well as decreasing bone formation. Okay, so in states of insufficiency, like Addison's disease, we would give this cortisone to try to replace that. But in these other states of like immune states or in the need to decrease inflammation and swelling, we could also give cortisone, okay? So that's really why we're going to be giving it, okay? A lot of times in post-op floors or SICUs, things like that, where I work, in neuro-ICU, we end up giving steroid hormones a lot to try to decrease the swelling of the brain after surgery and in states like that. So therapeutic class is antiasthmatic or corticosteroid. Pharmacologic class is corticosteroid. Some of the nursing considerations to keep in mind. Now, what you need to really keep in mind with any medication is that when we give a medication, we need to look at what's going to happen if it does too good of a job, okay? So for example, with cortisone, some of the things we need to keep in mind are osteoporosis or Cushingoid appearance as well. So remember, we're giving it to try to treat kind of the Addison's disease, but what we can do is we can actually cause this Cushingoid appearance, a buffalo hump, the moon face, things of a patient who would have Cushing's. And then so we need to also watch out for increased blood sugars. It can also increase cholesterol and lipid levels. It can lead to decreased wound healing. Remember, it's going to decrease our immune response. It can lead to peptic ulcers. It can cause CNS alterations. And we need to avoid in active, untreated infections. Okay, so if a patient has an active infection, we don't want to give these corticosteroids because they're going to decrease the immune response, and then that infection could actually worsen. Okay, so one other thing to keep in mind here is we want to monitor liver profile and watch out for weight gain in our patients. Now, what you'll notice a lot of times with these, and this would happen all the time, almost every night, right? At 10 o'clock, I give my steroid. I go take my midnight blood sugars, and the patient's blood sugars are 400, okay? Because they're taking these glucocorticoids, and that's going to really elevate the blood sugars. So you're going to have these patients a lot of time on at least Q4-hour blood sugars, possibly more, depending on how it affects their blood sugars. But you're going to be watching those blood sugars and monitoring them closely so the patient doesn't skyrocket their blood sugars. All right, that is cortisone. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.